Vitamins are organic compounds that are essential for proper metabolic functioning of the body. And this basically means that vitamins help with the development as well as the maintenance of the body. When it comes to functions, vitamin plays different roles, such as roles with the immune system, digestion, bone health, vision, as well as nerve function. Now, when it comes to the different classes of vitamins, you have two classes. You have water soluble vitamins, and then you have fat soluble vitamins. Focusing on the water soluble part. So you have the B classes, and then you have vitamin C. With water soluble vitamins, these are going to be the vitamins that easily dissolve in water, but they're also not going to be easily synthesized or vitamins that are stored or made by the body, which means that you have to typically get these vitamins from food or supplement. Now, when it comes to the fat soluble vitamins, these are going to be vitamins A, D, E, and K, which I like to remember an acronym DIC. And when it comes to the fat soluble vitamins, these are going to be easily solubilized in fats, but they're also going to be synthesized and stored in the fat tissues of the body as well as the liver. Now, one note about the excess level with each of these classes of vitamins. When it comes to water soluble vitamins, taking an excess amount, you can typically excrete these via the urine or feces, and that is typically not an issue, though the levels may be high in your blood test. When it comes to the fat soluble vitamins, it is important to not have an excess amount because otherwise it can cause some toxicity issues in the liver, because again, this is where in the liver as well as the fat tissues a lot of the fat soluble vitamins are stored. So when we think about this, vitamins are micronutrients, but just because they're micronutrients does not mean that they do not carry weight, because micro just means that it's small quantity. But if you were to push that decimal place over to the right, then you'll realize that that micro amount, let's say it may be 1,000 picograms, can easily turn into 1,000 or even 1 million picograms, which can be converted to micrograms or even milligrams, depending on how far that goes. So it is important to ensure that you are within the recommended range of whatever particular vitamin you need. Now, speaking of how much vitamin do you need, this is going to essentially be determined, at least your current vitamin levels, by lab tests. And you can easily get these from a physician, run some blood tests on your panels, as well as you can get it from a third party where you can select the appropriate vitamin panel test and you can get your results submitted, and then you'll wait to see at least if your results are abnormal, meaning if your vitamin levels are lower than the threshold that's indicated or higher than the threshold indicated, or if they fall into the normal range, okay? So when it comes to vitamins, most of the times you can get them from foods, but in other situations, you may get them from supplements, or even you may have your physician prescribe you a dosage, especially if, for example, you may have low levels of vitamin D, and so your physician may then have to put in a prescription, for example, 50,000 international units of vitamin D for several months in order for that level to rise up. So again, when it comes to vitamins, they play a critical role in the body, okay? If you start to notice some health issues, and then you also get your labs tests done, and you see that, hey, my vitamin levels are lower in this area, and I'm also experiencing some issues, and I see that this low level of this particular vitamin corresponds with the issues that I'm having, it's likely a good chance that you need to increase that level to avoid that issue becoming more problematic. So this is just something to keep in mind. And if you have any questions, feel free to let me know.